So, all right, so I'm going to next introduce our presenter, Belkis Garcia. Belkis is an attorney with the Legal Aid Society, and she's going to be sharing expertise on accessing dental care for Medicaid recipients. Also with us today are our member relations liaisons, who not only provide support to our members, caregivers, and care management, but they also have children, adult children that are members of the CCO. Their names are Shailene Fellows, Kevin Carmen, Ron Louvier, and Stacy Mason, and I'm going to let them kind of give a little bit more information about themselves throughout the presentation. All right, so with that, I'm going to hand it over to Belkis to begin our discussion.
Great, thank you so much. Hi, everybody. Thank you so much for having me. I was excited to see that there was so much interest in this topic. I guess just at the top, this is going to be as kind of an overview on the state of this now. And I understand people are probably going to have questions about your individual issues. We're going to try to do kind of a high level overview now. So I'm going to share my screen if I can make this work. Share. How do I know which one it's sharing? I think it's this. You'll tell me if I did this right. It says connecting. Can you see it? All right, cool. Now I just have to figure out how to move it forward. Okay. All right. Again, my name is Belkis Garcia. I'm a staff attorney at the Legal Aid Society. We are a legal services organization in New York City, representing people in the 5 boroughs. For many years, I've been working on Medicaid coverage of dental services, but Medicaid is a statewide program, right? So these rules are going to apply to everybody across the state, what we're talking about today. So the plan for today is to do a little introduction, background information to get us a little bit on the same page, an overview of what is new about these specific services, which we'll go into, but those services are root canals, crowns, replacement dentures, and dental implants. And we're going to try to leave as much time as possible for questions and discussion. Okay, so I'm going to start with this general idea about like why oral health care is important. Oral health care and overall health inextricably linked. I think that this is common sense for a lot of people. It just kind of makes sense, right? Like you need your teeth to chew, and diet is important for so many health, like chronic conditions and health issues. But beyond that, they really are issues that are health and oral health and overall health are linked in very many ways. And when the connections between poor oral health and how that can exacerbate chronic conditions is pretty well documented. And I think something I have learned over the course of working on this is just like how deep the connection is between oral health and mental health. So these things it's important, right? Despite that, we have not here in New York had a really robust Medicaid dental program. Hopefully we are moving towards that direction now, but historically that's true. So this presentation, this discussion is going to be about Medicaid. Medicaid is a public health insurance program for qualifying low-income people. We've had it in New York since it was enacted federally. It's a federal law, but the states, each have their own Medicaid program. And so we in New York we have Medicaid, and we include a dental benefit, which is optional under the law, but we have a dental benefit in New York. Today, it is the largest public health insurance program in the country, and in New York, about 8 million people, and it covers medically necessary covered services. So we're gonna dig in a little bit more about what that last phrase means with regard to dental care. If you are a Medicaid recipient and you go to the doctor and you access health care, you know this because this is should not be different than accessing any other health care that you receive. You have to find an in-network provider who takes your insurance. You go to that provider, you get a treatment plan, you work out a treatment plan, you get the treatment plan from the provider for services that require pre-approval. Your provider puts in for pre-approval to your insurance. These services today do require that. and you either get an approval or a denial. We'll talk a little bit more about what happens with denials a little later. That's how this is supposed to work. But there are challenges all along the way. People, I think I wouldn't have a job. I think a lot of other people on this call wouldn't have a job if it were just that easy. And it's difficult to navigate this process. And that really starts with finding a provider. And that's particularly true, as somebody was mentioning before, for dental. There are not enough providers in the state who take Medicaid. There are not enough dentists. So it's challenging. And the issues that I'm going to be talking about today are mostly, what's big and new and different in the state are the Medicaid coverage rules. But this first one, finding a provider, that's often where people have run into a challenge to begin with. So I'm going to talk a little bit about that. Most people in New York are, I don't know if that's going to be true about the folks on this call, but generally in New York, overwhelmingly, it's a Medicaid managed care program, which means you're enrolled in a health insurance company that administers your Medicaid benefits. That's what we have mostly in New York. And when you're enrolled in a Medicaid managed care plan, you have to see an in-network provider. And that means somebody that contracts with your plan, right? And the plans are supposed to help you find an in-network provider. They're required to do that. The way that you do that is you call your member services, the number on your card, it's usually in the back of your card, and you tell them, I need a list of the dentists that take my plan that are near me for my service, for what I need. Again, they have to help you find that. They'll send you a list. Many places have a website. If that's something you do, you can go online. These lists are required to be up to date. They often are not, but you're going to go and you're going to look at this list and you're going to go through and see who on that list you can see and who's accepting new patients, right? If you do that and there are no dentists accepting patients, none of them are near you, they can't do the care, the specific care that you need, the training, they don't have the training that is needed for your specific care. Medicaid managed care plans are required to help you get a referral to an out-of-network provider. They're required to coordinate this care for enrollees. So that is something that they have to do. If your plan is not helping you with that, my advice is that you file what's called a grievance, and you would again call the member services number and tell them you want to file a grievance or a complaint. Both of those words should get you to the right place, and they have to then respond to the grievance. If they aren't helping you, if that complaint doesn't result in you getting what you need, I really strongly suggest that you contact the New York State Department of Health and let them know that you didn't get what you needed. You weren't connected to care, you're not able to get assistance. And I have that information here at the end. I hope this is on here, but at the end, I also have a list of these resources. So you'll see the emails and websites that I post, you'll see them again later. If you have fee for service, so that's where you don't enroll in a managed care plan. You just have what's often called straight Medicaid, regular Medicaid. It is a different process. The Department of Health has these two websites to help you that list dentists who accept Medicaid. Again, this first one, they have a disclaimer on it that says, we can't promise that this is up to date, but that is their list on their website. The second one is also a fee-for-service locator. It's not user-friendly. I just kind of want to give you a heads up about that, but it does allow you to sort through by county or by specialist. So let's say you need an endodontist in, I don't know, Westchester. It will allow you to do that. If you are not finding what you need there, contact the Department of Health, the Medicaid helpline, and here I have the phone number and email. Okay, so once you there could be more we can say about that, but for now we're going to go on to like what you're actually entitled to, like what is it that's new. I think that in order to do that, it's helpful to talk a little bit about what used to be to kind of understand the context of what's different. So I'm just going to really briefly go over what the previous rules are, or the ones that are relevant here. So I guess what I want to say about this is that, like, here, the old rules of the old Medicaid coverage rules, they really were geared towards extracting teeth. That was kind of what they did. That's the primary treatment that you got covered through Medicaid. This is bad for the reasons we talked about before, right? Like when you lose teeth, you're more likely to lose more teeth, right? It has long been the standard of care that you should be able to treat and save your natural teeth where you can, right? Like if they can be saved, they should be saved. But unfortunately, what the previous rule was, is this thing that if you've ever done this before, this might sound familiar to you. It's called the 8 points of contact rule. What that rule said is if you have 4 pairs of teeth in the back of your mouth that touch, so that's what they're calling 8 points of contact, 4 teeth in the back of your mouth that touch, the Medicaid program, New York said, that's all you need. We don't think you need more than that. If you have those 4 teeth that touch and you need a root canal on a different tooth, we're just going to pull that. There's no coverage for that. I'm sorry, I should have said this earlier. This is about adults over 21. The rules are different for people under 21. So this rule applied before. So that what they would cover is they would say, okay, as long as you have 8 points of contact, we're not giving you a root canal or a crown, for example. Sorry. And they would continue to pull teeth until you lost those 8 points of contact. And then what you would be covered, or what is covered, are dentures. However, if you need new dentures, they're lost, they're broken, they only replace them every 8 years. Some exceptions to that, but generally only replaced every 8 years. I'm just going to skip through this. But if you're a person who can't wear dentures, there's a whole host of reasons why that might be true. At the time that we started this project, if you were a person who needed, let's say, for example, you had no teeth, and in order to hold a denture in place, you needed dental implants, that was an excluded service. You couldn't get that at all. So that was the landscape for many, many years. In 2018, we filed a lawsuit. The Legal Aid Society and our co-counsel filed a lawsuit to challenge the rules I just went over. Root canals, crowns, replacement dentures, dental implants. That we have worked on that for many years. That case settled in 2023, and the new rules have just gone into effect on January 31st, 2024. So you get connected to a dentist, you see that dentist, you need these services, these new rules are going to apply. Okay, so here's the general principles of the new rules are, this is an expansion. It's an expansion of coverage. The goal of it is to retain teeth when that's clinically appropriate. The rules are where they have always been in this Department of Health manual, and those are the rules, that plans can't be more restrictive than what you find in those rules. And another general principle that is helpful is that people used to get denials that say this is just not a covered benefit. They're not allowed to issue those denials anymore. I will just say we're still seeing them, but that's a mistake. You should, if you get a denial, that denial needs to be because they determined you don't qualify for it for some other reason, that it's not necessary. You don't meet the medically necessary requirements. The 8 points of contact rule I mentioned no longer applies to root canals and crowns. It just doesn't apply anymore. It will apply to other services, but it does not apply to those. The new rules say that if you're over 21, again, that's who these rules apply to. They're covered, root canals and crowns are going to be covered, and they're going to look at a series of factors to determine if it's covered. it gets very technical. We're going to try to go through this a little quickly, and this is really going to depend if you need these services. Your specific facts are going to be different for everybody, but they're looking at these general factors the same for everybody. If you have a condition where you can't get a tooth pulled, that's a factor for covering the treatment. If the tooth that needs the treatment is something that's holding a denture in place, for example, that's a factor for coverage. If we're talking about a back teeth, there are a bunch more factors that they're going to look at. Generally, can the tooth be saved? What's the prognosis? Can it just be fixed with a filling? That's something they're going to look at. And I've put these two in bold because I find they're the ones that apply to most people, which is that if you have those 8 points of contact, those 4 teeth in the back of your mouth, that's no longer a reason to pull teeth. That's now a reason to save them. If you have teeth, let's save your teeth, right? Like you're a person who might not be, losing more teeth down the road. And then this last one is if the back tooth is a molar, and you need it for balance or function, then that's a factor for like to chew, basically. Again, like they're going to have to look at what that specifically means for you, but that generally, if you need that tooth for balance and function, that's a factor towards coverage. If it's a front tooth, they're really just looking at those first 2 factors I mentioned. Your gum status, your overall compliance, overall status, and what of your mouth, and whether whether it can be saved, and whether it can just be fixed with a filling. All of these, you don't have to meet all of them. You don't have to look at everyone and say, do I meet all of these? That's not the rule. That they don't all have to be satisfied. Another change, it used to be that crown lengthening, which is something that you need to expose more of the crown in order to get the treatment, that used to be an excluded service. That is now covered when it's associated with a root canal or crown that is covered. Replacement dentures, you'll still see in the new rule that 8 years is the general time frame. But now it says, unless, if you need it within those 8 years, your dentist has to fill out a form and explain why you need it. And if you needed it in the first place, then you probably need a replacement. So your dentist needs to fill out that form, and I have a link for that form. The insurance company might have their specific form that looks a little different, but it's all the same information that they have to include. They have to submit that paperwork. Dental implants and related services. I'm finding that this one is more complicated and more difficult to kind of generalize about it, but let's go over the rules, which is implants, including single implants, will be covered when medically necessary. There's also a form that your dentist fills out. Like we talked about with the other one, this is the form. They have to fill out this different information. I think one thing I will point out here is that one of the things on the form that your dentist is going to need to explain is why you can't wear something else. So for example, if you can wear a removable denture, that's going to fix your problem, that's probably what Medicaid is going to cover. If that's going to work for you, that's what they're going to cover. If that's not going to work for you, that's what your dentist needs to say on this form. Why can't you wear a denture? Why isn't that going to work? So that's just part of the form that's important. But the whole form is important. Your dentist needs to fill it out. But that one trips up some people. Okay. You need one of these services. You find a dentist. You put in a request for it. And then the insurance company comes back and says, no, we're not covering this. You've been denied. If you are enrolled in Medicaid managed care, again, if you've been through this before, you know this process. It's the same for dental as other services. You get a denial notice. That's called an initial adverse determination. These are federal rules. You have to do a bunch of steps. It's a multi-step appeal process. You have to do a plan appeal. That's where you're saying to the insurance company, please look again. I think you made a mistake. In my experience, from my perspective, those people don't win those. I don't, maybe they do and I don't see it. I don't see those. I don't see people winning at that stage, but you have to do it. The response from the insurance company, if they say, no, we think we were right, then you get your next letter, which is called a final adverse determination. And that's when you then appeal to the state. And there are 2 appeal tracks in Medicaid managed care, an external appeal, and you can also do a fair hearing. We're not going to go into all the details of that, but I guess what I would say here is that if you get denied, you got to kind of have some fortitude and some grit, and you got to appeal. You can't guarantee that you're going to win on appeal, but we see a lot of people win. They make mistakes, and it can be frustrating. It is frustrating, but I really do encourage folks to exercise their appeal rights. If you are a fee-for-service recipient, also called Medicaid, you don't have the same appeal process. That is an appeal that goes directly to what's called a fair hearing. All of this should be in the notices that you're getting, but that's the general process. Okay, if you need help with a denial, if you've gotten a denial, what I've included here on this slide is the Legal Aid Society's intake number. We're open Monday through Friday, 10 to 3. What that is you talk to a general intake person who takes your information. We only can represent people in New York City. We can give advice to people outside of the city, but you also need to be income eligible for our services, and that you would do through that number. Oh, I forgot I put this in here. Okay, this is just to say that this all resulted from this lawsuit that I mentioned. These changes are the result of a settlement that we reached with the state. The settlement does not go on forever. I don't want to say the year because I'm afraid I'm going to get it wrong, but in 4 to 5 years, the state can go back to these old arcane rules. We hope they don't. We will be fighting and hopefully organizing against that. They claim they don't intend to, but there was a bill introduced last year to put some of these changes into law and to make amendments to our state laws to include them. So it didn't pass this year, but hopefully it'll be introduced, and just something for you all to be aware of. Okay, so these are some of the resources. Some of these are ones I had mentioned throughout. On our website, again, the Legal Aid Society's website, we have some Know Your Rights materials. This first one, using Medicaid to get your access health care, that it goes into it in much more detail. Still an overview of what your rights are and how to do it, but I find that one actually does help answer a lot of people's questions. We have more details on what the rules are, what the Medicaid coverage rules are for dental, some information about Medicaid hearings, and then I've also included where the actual rules are that we were talking about. They're not really written in consumer-friendly ways, but this is where the rules are. These 2 links. So the rules are in this thing called what we call the Dental Manual for short. And then there is a link to the clinical criteria guidance, and that's a document that also specific to these changes. I find that one to be more helpful. It also has some examples in it. It explains the changes in more detail. These are the websites that I had mentioned before, where the Department of Health lists fee-for-service providers. The first one specifically about dentists. Yep. Okay. That's it. That's my whole thing. So we can stop here for discussion and questions. I will stop sharing. Did that work? Okay.
Right. I'm just going to unmute myself. Let's see. Would you rather do questions now, or Stacy, do you want to talk a little bit about your personal experience, and then we can kind of get to the questions in the chat? Totally.
Yeah, sorry, I meant to say that was from before. Yeah, so I'm actually here through Stacy, who we had talked about that kind of finding the provider part of it. Stacey did some incredible advocacy and is gonna share that experience.
Sure. Thank you, Belkis. And yes, I was extremely lucky to meet Belkis because I was struggling with dental issues for my two sons. So first off, I am a member relations liaison. I work for Life Plan. I have two sons who are 26 and 24 who are Life Plan members. They're both autistic. And unfortunately, they're very phobic about dental care. So like a lot of you, I'm sure, they need general anesthesia to have any kind of significant dental work done. And my son, Trevor, who's 26, ended up with a fistula on his gum last June, which is like a little blister bubble on his gum. We took him to an emergency dentist. Of course, we weren't even home. We were in Florida. And that dentist said, Trevor, unfortunately, needs a root canal. That started me on my journey of trying to find an endodontist or a dentist who does root canals, to find an endodontist who would perform a root canal on him under general anesthesia. So, of course, I went directly to Fidelis, and Fidelis did not help me in a nutshell. You know, I tried contacting all of their endodontists on their provider list. None of them did root canals under general anesthesia. I, spent many hours calling all of their providers, having people telling me that some of them did do root canals under general anesthesia, but unfortunately not everyone even knows what general anesthesia means. So we wasted a lot of time there making appointments, bringing him to dentists and endodontists who told us when we got there that they actually don't do general anesthesia. I would call Fidelis back, tell them what happened, and ask them where we go from here. And basically what happened is people just stopped returning my phone calls. And it was clear that it was extremely intentional. So I had connected with a few people at Fidelis, which is their managed care plan, and DentaQuest is the dental provider. So eventually, I started getting really creative, and I ended up calling the New York State Dental Association, who finally actually put me in touch with Belkis, which was so lucky. So Belkis basically gave me a list of steps to take in order to get this situation resolved. And, intuitively, I knew that Fidelis was wrong for giving me the runaround and not helping me. But when Belkis told me that insurance companies are required by law to have an adequate network of providers. When she told me that, I took that and ran with it. I immediately filed a complaint with the Department of Health Managed Care Complaint Unit, and they got back to me the next day, and they started a investigation. And pretty much within a couple of weeks, maybe even less than that, I got a call from the member relations department of DentaQuest, and they started working on solving this problem. So I actually had found a few providers who could work together to do the whole dental procedure, the root canal, and the anesthesia. And DentaQuest agreed to pay them all. And not only to pay them, but to pay their asking price, not the Medicaid rate, but their actual asking price. Now, the only problem with that, if you will, is that I had to lay out the money, because that's what the dentists demanded. They said that they did not want to wait for Medicaid to pay them. Now, two of them agreed to have Medicaid pay them after the fact and reimburse me from that money, but the anesthesiologist didn't want to have anything to do with the Medicaid money whatsoever. And we almost thought that the whole thing was going to fall apart. But eventually Medicaid agreed to pay me directly, which is another thing that's kind of unheard of. And they sent me a check for $6,000, which was pretty amazing. I mean, the other thing that's wrong with all of this is that it took me probably 100 hours of work to get all of this sorted out. And so out of that came my motivation to share my experience and to have Belkis do this presentation so that none of you will have to spend the amount of time that I had to spend on this for your loved one. So, thank you for being here. Thank you for listening. And I hope that between what Belkis has shared and what I have shared, this will really help all of you. And now we definitely want to get to your questions.
I can just add, what Stacey did is incredible, and also had the knowledge and wherewithal and energy. It's so hard. I think the part of that I want to caution you all that when Stacey got to this part where they said you have to pay up front, I really want people to be careful. Don't, Medicaid recipients have very clear billing protections. You cannot be billed as a Medicaid recipient unless you agree up front to pay out of pocket. And I wouldn't want, because I do get this question a lot, like, what if I just pay for it? Can I get reimbursed? I mean, the answer to that is so often no. So Stacey had to do a lot of work to make sure, am I actually going to get reimbursed? Because it is, in fact, it's pretty unheard of. And people do have to appeal these. That's the other thing. When you look, there's a database of appeals. You look, there are a bunch of people seeking, who go to appeal on these, but that thing in particular, people sometimes pay out of pocket with the expectation that they're going to get their money back. And be careful, that is not going to be the case unless you've done a lot of work up front.
Thank you so much.
Yeah. I just want to add, yes, I did not want to go through with that procedure, which totaled $15,000 until I had the approval in writing that I was going to be reimbursed by everybody in every way. And if I had not had that, I don't think I would have gone through with it, as much as it was a real dilemma for me, because I desperately wanted my son to get that work done. And I did not want it to go on any longer, because it took a year really from start to finish. But $15,000 is a lot of money. And I did not want to go through with it until I had approval for getting reimbursed. So just wanted to add that.
Thank you, Stacey. Thanks for adding that. I was actually going to ask you how long the process took, so I'm glad you mentioned that at the end. Thank you so much. All right, we're going to get to some of the questions in the chat.
Hear me? Can you hear me?
Hi, yeah.
Okay. My name is Gülser. I have 26-year-old daughter. She is on Medicaid and Medicare. I don't know how to get an dental insurance or how to get an approval. All the dentists, they're declined to take Medicaid. So I find in the open door, in the Oceaning, I live in Westchester, before they were covering, in the last April, I care for the just regular cleaning. I receive a bill, it says they're not covering anything. I don't know how to get an approval before I take her to the dentist, or what to do, because they're not covering at all. How can I get the dental insurance or the dental provider for her?
Yeah, I think that's probably a question a lot of people have. So the type of insurance you have is going to depend on how to answer that question. People who have both Medicare and Medicaid, Medicare does not cover, it's not a dental benefit. Sometimes people are enrolled in dual plans or a certain Medicare Advantage plan that says they cover $1,000, $2,000 towards dental. That it's not full dental coverage, right? And it's the Medicaid part of that has a dental benefit. So if you have to go to a dentist who accepts your insurance. That's kind of the first step. And again, as Stacy was sharing, right, you have to start there. You have to find somebody who accepts your insurance. They need to submit the claim to your insurance, and then it gets approved or denied before you have the service, right? And then you can, if they say, no, we're not covering, we think this is not covered, that's one thing. But if they don't take your insurance to begin with, then they can't bill your insurance if they're not in network. And so we have a resource guide on our website, the how to get Medicaid, how to use your Medicaid benefits, that kind of is generally not specific to dental, but generally how you find a provider. But you find a provider in network, they have to submit to your insurance and then get an approval or a denial. And if it's denied, you have to appeal it.
Insurance before, but now she's 26. They denied to have her insurance coverage continues. But the bill I have, it comes from Anthem. I don't know how did it go to Anthem. Anthem, Blue Cross and Blue Shield. I didn't apply for anything. And is it go through the Medicaid, the Anthem insurance?
Okay, can I jump in there? Hi, my name's Ron Lubier. I'm a liaison for Life Plan and ACA. And I guess one of the ultimate questions is, does your daughter have a commercial insurance also?
She doesn't have commercial insurance.
I'm sorry?
She doesn't have because they denied.
Okay. And Dulcie, if I said your name incorrectly, I apologize. I think most of the people here are going to be straight Medicaid. Not all, but most, especially if they have dual insurance. And I don't know, can you explain if you have dual insurance, such as Medicare?
Medicare, Medicaid, she has both.
Technically, you're supposed to have a managed.
I'm so sorry. I just want to make sure that because your question is very specific, and I want to make sure that we're giving you like all the information specific to your family member. So if you could reach out to either your care manager or put the email box in the chat, we can talk to you outside of this meeting and talk about all the things that you need.
Tomorrow, care manager will come. I asked her so many times about dental insurance because they all deny her because they're not taking Medicaid. And then, can I get insurance through the Medicaid dental insurance or no?
So that's what I think. I'm sorry, Kate.
Go ahead.
I think she's talking about straight Medicaid.
Yes.
And if you can elaborate a little more on the difference between straight Medicaid and managed Medicaid. And the other question I think with that is, if they are a managed Medicaid provider, are they going to be a straight Medicaid provider?
Sure. So the difference between Medicaid managed care and fee for service. So New York, when Medicaid was created, it was before managed care existed, right? You apply for Medicaid. If you're eligible for Medicaid, you get your card, you go to the doctor, you show them your Medicaid card, and the government pays that doctor. That is not how most of Medicaid works anymore, but that's what is called straight Medicaid or fee for service Medicaid. In the beginning in 1995, New York became a Medicaid managed care state. That is where the state, when you apply for Medicaid and you get approved, you then have to enroll an insurance company, Health First, Blue Cross, Fidelis, there's a bunch of them. You then have to enroll in a plan. And that Medicaid managed care plan administers your Medicaid benefits. This part is invisible to you, but it means that the state is contracting with that plan, and the plan contracts with a network of doctors and dentists and providers. And as a Medicaid recipient, when you enroll in a plan, you have to see a provider who takes your insurance plan. That is what the difference, that's the difference between fee for service. I mean, there's much more, but that's generally the deal. New York is, I don't know, it's something like 95%, 98% of people in New York are enrolled in Medicaid managed care plans because it's mandatory. There are some people for whom it's not mandatory, and certain populations, and this call may be disproportionately people who are enrolled in straight Medicaid. One of the populations for whom that's true is if you are a dual recipient. If you have Medicare, different program. Medicare is not Medicaid. If you have Medicare, Medicare is your primary insurance and Medicaid is your secondary insurance. Medicare does not cover dental. That's what I was explaining before. And who's going to cover the dental is the Medicaid. And that part of it is much more complicated to answer in a general way here. You may have a certain type of dual plan. You might have something that's called a dual SNP plan. You might have, there's really different ways to be a dual, different types of plans. At the end of the day, it is the Medicaid that is covering the dental care. There is a proposal which has not yet been put into effect that will, for people enrolled in a certain dual plan, a dual SNP, that will have those benefits together, but that's not happening today. That's not what the rule is right now, and it's not for all dual recipients. And that's why your specific plan, your specific insurance coverage is going to be different. But at the end of the day, it's your Medicaid that is, as of now, that's going to be covering the services we've talked about today. And I listed some websites that the Department of Health has that has fee-for-service dental providers, and you need to call them and see if you can get an appointment with them.
So if I understand, I'm sorry, Kate.
I just want to ask everyone just to please stay muted during the Q&A part of this. We're going to go through the chat box and answer all the questions there. So throw a question in the chat box if you have questions. There's just a lot of people on the call, so we want to make sure that we get to everybody that we can. And also, don't hesitate to reach out after the forum if you have more questions, of course. Let me see. So, Belkis, please discuss the procedure for adults who live in a group home. I think this one will be beneficial.
I'm not on mute. Okay. Yeah, the rules, if you are a Medicaid recipient, the coverage rules are going to be the same for everybody, and it kind of doesn't matter where you live. I would say I am not an expert on how people in group homes access services. But it shouldn't be. I mean, the challenge here is that there are just so few Medicaid dentists. And that isn't just a New York problem, by the way. This is like across the country. And this year's Governor Hochul's State of the State, she included some proposals about increasing dentists who accept Medicaid. But the process to access dental care, whether if you're in a group home or you're elsewhere in the community, it's the same, right? It's like however you go to see a doctor, if you have a care coordinator, if you have somebody who helps coordinate that, if you were to, I don't know, go to PT, it's going to be the same thing, right? And the coverage rules are the coverage rules we've gone over today are the same regardless of where you live.
Okay, thank you so much.
Take when a provider can't be found within the network.
Leslie, can you mute, please? I'm so sorry. Thank you. Okay, let's see. So here's another good one. Would the fact that the person is likely to lose or accidentally throw away the denture, like a partial, would that be a valid reason to improve an implant?
Oh, that's a really interesting question. I don't know. I mean, I would say that's not what the rule says. Is if you can wear a denture, you need to explain why you can't wear a denture. It sounds like what you're saying is this is a person who cannot hold on to it, who, let's say, due to cognitive impairment or maybe housing instability, some reason why you're very likely to lose it. I think you could make the argument. What I would predict in that situation is that You could make that argument. It could be a part of your prior authorization request. I think that would be denied because they would say medically, you can wear a denture. We'll replace the denture if you lose it, right? That's what I think they would say. If you have specific facts that you could put forward, I would say you should still exercise your appeal rights, but I would say strictly speaking, the rules are they'll replace the denture within those 8 years if you need a new denture. When you're, if the dentist fills out that form and explains why you need it. There is, I will also say there is a part of that form that says, if you've already had a denture replaced in the past 8 years, once at least, there is another line that says, explain to us what steps have been taken to avoid this in the future. That's not the exact language. That part of the rule, who I think of when I think of that line in the form, is one of our named plaintiffs in the lawsuit was homeless for decades and lost both his upper and lower denture at different times while street homeless. And through the time of the case, he became housed and he had supportive housing. So had he been able to benefit from this rule, he's somebody who I think that line would have said, he's now housed, he has social workers, he has support. That's what's different, right? I think that you would be expected to replace your denture. That's what I believe. But again, everybody's specific facts might be different, and you could make that argument. But I think you would be expected to apply for a replacement denture.
Thank you. All right, Jennifer asked, I live in Orange County, New York. Is there legal aid services in this area?
I don't know offhand, but like who the provider is, but I'm gonna say yes. I mean, there is I don't know offhand. I think I would say connect with folks after to see how to find a legal services provider near you. There's also a statewide program called Community Health Advocates, and that's an 800 number. They would be able to connect you to a health advocate. That's just off the top of my head, but I would say somebody should follow up with you for something more specific.
Okay, thank you so much. There also is a comment that I think is helpful from John in the chat. He's mentioning a clinic that accepts Medicaid in Suffolk County. So I will make sure that information is also sent out in all of the info that we send after this. So you'll get all of the information in an email. So we'll make sure you have everything. Let's see.
Hey, can I just jump in really quick
sure.
while you look at the chat? I see that there are a lot of questions and comments about people looking for places, how to find a provider that's in my network. Or in your network. So in Belky's presentation that she did, there were some links to find providers, and we'll send that out to everyone who registered. And then remember that if you do have a Medicaid managed care plan, you can call the Medicaid managed care plan, and they're obligated, I believe I'm saying this correctly, to help you find an in-network provider. So just something to keep in mind. And just to reiterate what Kate said, there are a lot of really person-specific questions in the chat, and we really want to make sure that folks are emailing us directly with those person-specific questions, because we will be able to give so much more of a thoughtful answer and an individualized answer and guidance if we can have those conversations outside of this meeting. And we also have access to Stacy, who I'm going to overwhelm with these specific questions, and she will love it. So, okay, go ahead, Kate.
Thanks, Lindsay. Let's see here. Carol asks, she said, I'm confused about Medicaid managed care being required. I thought that to enroll, one would disenroll from OPWDD services. Enroll in MMC.
Yeah, so that's a general, so Medicaid managed care is mandatory for most people, but not everybody. And some of the populations and there are people who are also excluded. Many of the waivers are not required. I'm not sure if it's excluded or not required to be in Medicaid managed care. So yes, you just may be a person who can't be in a plan, and then you have fee for service, right? So that, and again, like, but there are some, like, you know, Stacy's children are enrolled in Medicaid managed care. It's going to be different for different people, and it really depends specifically on the waiver that you're in, the specific population. As a general rule, New York requires most people, though not everybody, to enroll in managed care. And I understand that this group, these folks, more than the state at large, there are going to be more people in fee for service here than, you know, percentage wise, than we would see in the rest of the state.
And just to add to that, Belkis and everyone, this is something your care manager can help you with, right? So I would really encourage you, if you are thinking maybe disenrolling from a Medicaid managed care plan or vice versa, enrolling in a Medicaid managed care plan, please, please, please bring this up with us or your care manager, because you want to make sure that that doesn't put any of your other providers or other services at risk. So your care manager can help you to call the local Department of Social Security or your Medicaid managed care plan and help you understand the process and what questions to ask, so that you're not losing something to gain something, and you can make an informed decision about your insurance.
Thank you, Lindsay. Let's see here. Sharon asked, if someone has Medicare and Medicaid, can they purchase a private dental insurance?
Well, that's a good question. So yeah, so what I was saying before is that if you have Medicare, that is your primary insurance. Medicare does not include dental. And let's say for a moment you don't have Medicaid, you're just a Medicare recipient. Yes, many people do purchase a dental plan. If you have both Medicare and Medicaid, which was your question, the Medicaid, you know, it should be covering your, you know, the dental services that it covers. If you were to buy a dental plan, I think I would need to look at you. You may buy one, you may, but I think then you might be required to use that private insurance before Medicaid paid. I think that's right. And I don't know, it's a reality that you might decide to buy a plan because that gets you access that you're having trouble to get in Medicaid, right? But Medicaid should be covering a lot of these basic services that you need.
And I just want to add, Belkis, that in our case, the dentist that we eventually ended up using and the anesthesiologist actually don't participate with any insurance companies at all. So I thought of that as a solution, but that wouldn't have helped me. I still would have had to have found an endodontist who does root canals under general anesthesia, and there really aren't that many of them. So my best bet really turned out to be getting DentaQuest to pay for that endodontist who does not participate in any insurance. So I just wanted to throw that out there because there's really no easy answer, but you know, that was the least, actually the best and the least expensive option for us. But it took a lot of time. Yeah, that was the drawback.
Thank you, Stacy. Lindsay, we're going to say something? Okay, I thought you unmuted. All right, so we only have a few minutes left, so I'll try to get to one more question if I can. This is an interesting one that I think is important. So Allison asked, why is this process so difficult and how do we change that?
I love that question. It is, so yeah, this is like not a thing we can answer in a few minutes. There's a very good book, I think, that talks about the issue nationally. Why is it so difficult? I think what you all are raising is it starts with there not being enough providers enrolled in Medicaid. I think if you were to ask the dentists why they don't enroll, or when I have asked them, they say they don't get paid enough. I think that that is true. I think that's a huge problem. I don't think that's the only problem. I think people who are enrolled in Medicaid experience a lot of discrimination just because of their insurance or an expectation about what kind of patient they will be. So I think it's deep. It's got a long history. It's entrenched. It has a sexist history. It has a racist history, right? Like it's long and hard and complicated. What do we do to change it? I love the idea that this group of people, there's so many of you here, are engaged on making this better for your families and your communities and New Yorkers at large. I would encourage people to generally, and it sounds like you might already be these people, like to be engaged on the issue, to talk to first work with your care managers, the people you have here, they're your support networks, and this year, I had mentioned Governor Hochul put forward it as something important to her and her administration to try to make this better. And I would say to be more politically involved, to push your electeds on this issue is always a good thing. And I actually think that it is meaningful to file the complaints. Again, this is managed care specific, and I think this would be true about fee-for-service too, but to reach out to the state and let them know that you're having a hard time. The managed care complaint line is something that the Department of Health often cites when we as health advocates, when we raise something and say, we've seen this in our cases and our client population and our communities, they will sometimes say, well, nobody's complained about it. We don't have any complaints to the complaint line. And so I actually think it is helpful. Like sometimes people will say, I filed the complaint, nothing happened, but I think it's still make noise. It's still really good to make noise so that they aren't then saying, well, nobody said anything. Even just logging complaints, I think is a good place to start.
Thank you so much. I think that's a great ending conversation for this session. Thank you so much. I know we weren't able to get to all the questions, so please reach out to us or your care manager. You're going to be receiving an email with all of the info. And yeah, thank you so much for joining us. And we hope to see you at future forums.